My name is Josie Wiles, and I am a Master of Public Health student at the University of South Florida. During my time in graduate school at USF, I have also been completing the USF Dietetic Internship. This lesson was created as the final project for the class HUN 5265 Nutritional Assessment. This lesson is titled the Perfect PES Statement, and it focuses on the diagnosis step in the nutrition care process. Please take the time to pause the video at this time and take the pre-instructional test. This will help us gauge how helpful the course was. If you have any difficulties scanning the QR code, there is a link in the lesson plan. During this presentation, we will go over a brief summary of the nutrition care process as a whole, but we will focus on the diagnosis step. The diagnosis phase of the nutrition care process is where the registered dietitian or the nutrition professional curates a PES statement, which stands for problem, etiology of the problem, and signs and symptoms of the nutrition problem. Lastly, we will go over an example from practice to work together to create the best PES statement for the case study individual. The nutrition care process is often summarized into 4 steps: the nutrition assessment, nutrition diagnosis, nutrition intervention, and nutrition monitoring and evaluation. In the inpatient setting, nutrition screening is also important to identify patients at risk that need our services. The NCP was developed by the Academy of Nutrition and Dietetics and other nutrition professionals. It is intended to improve consistency and quality of care, but not to standardize nutrition care for clients. It is important to remember to still use clinical judgment to best provide care for the individual. Since this module is created to specifically discuss the diagnosis step, we will further discuss diagnosis in upcoming slides. The nutrition diagnosis is written as a PES statement, which includes the problem, etiology, and signs and symptoms of the problem. The problem statement should use official nutrition care process terminology, which can be found online at the ENCPT website. The statements are organized into 3 domains: intake, clinical, and behavioral environmental. When possible, it is most appropriate to choose a problem from the intake domain, as that is the domain that we have the largest scope of practice in and can make the most useful intervention recommendations. The etiology does not need a specific standardized language, but it should be the root cause of the problem, and it should be something the nutrition professional can focus their intervention on. The signs and symptoms are typically facts gathered during assessment that show evidence for the problem. During my time in my med-surg inpatient clinical rotation, I had the following case on my patient list one day. During screening, her chart reviewed showed that she had been here in the past for the same reason, and she had received diet education from the clinical nutrition department in a previous admission. A 46-year-old female with a blood glucose of 376 on admission and an A1C of 11.3%, with an existing diagnosis of type 2 diabetes that she has previously received education on before. Information collected at assessment included a 24-hour recall that revealed the patient typically skips breakfast and typically has fast food with a regular soda for lunch, a second regular soda, and a mini bag of chips for a snack. Her typical dinner includes pasta and a salad. The patient reported no recent weight change, but admitted to more frequent exhaustion or feeling sick sometimes, resulting in skipping dinner. If you would like to pause the video and write a PES statement that could apply to the case, please do so. On the next slide, we will discuss possible PES statements and select the most appropriate one. I took the liberty of choosing 3 potential PES statements for the case study. The first possible PES statement is altered nutrition-related laboratory values related to type 2 diabetes diagnosis and evidenced by a blood glucose level of 376 at admission and an A1C of 11.3. This PES statement comes from the clinical domain of the NCPT. The second PES statement is inconsistent carbohydrate intake, related to an average 24-hour food and nutrient intake, as evidenced by skipping breakfast, having large amounts of carbohydrates in one meal, and occasionally skipping dinner. The problem in this PES statement comes from the intake domain of the NCPT. The third PES statement is limited adherence to nutrition-related recommendations related to undesirable food choices, as evidenced by receiving education in the past. This PES statement comes from the behavioral environmental domain of the NCPT. There are more possible PES statements that could be used in this situation, but the second one highlighted in purple is the one that most pertains to intake, which best fits into our scope of practice as a nutrition professional. We can tailor our intervention at educating the patient on their intake. Please take a moment to pause the video to complete this post-test so we can better understand how the efficacy of this learning module. Again, if you experience any issues with the QR code, there is a link in the lesson plan. Thank you for your participation in this learning module. If you have any questions about the material covered in this content, please email josephinewiles@usf.edu. Thank you.